Welcome to Bella's World, where real-life drama meets spicy secrets. Subscribe to never miss a new story.
I took $8,000 from our joint account for breast enhancement surgery. The money was supposed to be for his mom's cancer treatment. When Brad freaked out, I said he should be grateful I'm making myself prettier for him. He packed his bags that same night. This morning, when Brad saw the bank statement, he lost his mind. He was screaming about how those $8,000 were for his mom's cancer treatment. He kept yelling about how she'd been waiting months for treatment and how the private clinic needed payment up front. I told him his mom is already old, and I'm only 28, so who needs beauty more? He stared at me like I was some kind of monster. Before I walk you through the full story, I just have a small favor to ask. Make sure to subscribe to the channel, hit that like button, and let me know in the comments. What city are you watching from? It's always amazing to see how far this audience is reaching. He said those were the exact words I used, that his mother was old and I was young, so who deserved the investment more? He said I'd stolen money from a dying woman to make my chest bigger. I corrected him that I'd invested our joint savings in our relationship and our future together. He said taking $8,000 without discussion wasn't investing, it was theft. Brad asked how I could live with myself knowing his mom couldn't get the treatment she needed because of my choices. I told him we could always save up the money again, but my 20s wouldn't last forever, and this was the perfect time to enhance my appearance. He said his mom had already postponed treatment twice because of money issues, and that waiting longer could seriously affect her survival chances. I said that just proved she was stronger than people thought. I told him that when he saw how amazing I looked in a few months, he'd realize this was absolutely the right choice for our future. He said I was sick and needed help if I thought stealing from his dying mother was acceptable. I said the only sick person was his drama queen mother, who probably didn't even have real cancer. He got so angry when I said that I thought he might actually hit me, but instead he just walked to our bedroom and started packing his suitcases. He said he couldn't be with someone who would steal from his dying mother. An hour later, he was gone with all his stuff, and I haven't seen him since. My name is Jessica. I'm 28 years old, and I've been with Brad for 3 years. We've been living together for a year and a half in his downtown apartment. I work part-time doing nails at Bella's beauty salon, but Brad makes the real money as a software engineer. He's always been responsible with finances, which is boring but useful when you need someone reliable. His mom, Carol, got diagnosed with stage 2 breast cancer 6 months ago. Brad immediately became obsessed with finding the best private cancer clinic in the state. He said the regular hospital wasn't good enough and that his mom deserved the absolute best care money could buy. Every conversation turned into talk about cancer treatments and survival statistics. Every time I wanted to go out for dinner or buy something nice, Brad would lecture me about saving every penny for his mom's treatment. He started working overtime and picking up weekend projects to earn extra money. Instead of spending time with me, he'd be researching clinical trials online or talking to doctors on the phone. Everyone praised him for being such a devoted son. His family would go on about what a wonderful man he was, sacrificing everything for his mother. Meanwhile, I'm sitting there being ignored while he obsesses over someone who's probably going to pass away anyway. Elderly people get cancer all the time. 3 months ago, I was watching a romantic movie while Brad worked on his laptop. There was this actress with perfect curves, and I noticed Brad glanced up when she appeared. He made some comment about how gorgeous she was, then went back to work. But I saw the way he looked at her. That night after Brad fell asleep, I checked his internet history, page after page of adult websites featuring women with enhanced figures. Some had obviously fake implants, and Brad had spent hours looking at them. I felt sick realizing what he really wanted. Every woman had at least a D cup, and I was barely a B. The next day at work, I started researching plastic surgeons. I'd never seriously considered enhancement before, but now it seemed like the obvious solution. If Brad wanted a girlfriend with bigger assets, I could give him exactly what he wanted. I made appointments with 3 different surgeons over the next few weeks. I told Brad I was working extra shifts when I was actually meeting with doctors. Each consultation was exciting because they showed me computer simulations of how I'd look with different sizes. Dr. Martinez was cheapest at $5,000, but his office looked sketchy. Doctor. Johnson was middle range at 6,000, but he'd only been doing enhancements for 2 years. Dr. Smith was the most expensive at 8,000, but his office was beautiful and his portfolio was incredible. Doctors say Smith had 15 years of experience and specialized in natural looking enhancement. His before and after photos were amazing. He used only the highest quality implants from Germany, and his technique resulted in more natural movement compared to cheaper options. During consultations, Dr. Smith kept asking if my partner supported my decision. I told him Brad would be thrilled once he saw the results. I explained that my boyfriend obviously preferred women with larger assets based on his online activity, and this would give him exactly what he wanted. Dr. Smith seemed concerned about something. He asked if Brad and I had discussed the financial investment together. I said Brad trusted me to make good decisions about our money, and this would be a wonderful surprise. The doctor went through risks and recovery information, but I was too excited about results to pay attention. He said complications were very rare with his technique, and most women were completely satisfied. I scheduled surgery for a month later and put down a deposit using my credit card. While planning surgery, Brad continued obsessing over his mother's treatment. He'd saved almost exactly $8,000 over 2 years by working overtime and cutting expenses. Every week, he'd transfer money from his paycheck into savings, talking about how his mom deserved the best possible care. He'd show me printouts about different oncologists, explaining why the private clinic was better than public hospitals. I listened while secretly planning how I'd use that money for my enhancement. Brad was so focused on his dying mother that he wasn't thinking about our relationship's future. Someone needed to make smart decisions about priorities. The day of surgery, I waited until Brad left for work before going to the bank. I withdrew $8,000 in cash, hands shaking as I signed paperwork. I reminded myself this was an investment in our relationship. Brad would thank me later when he realized how amazing I looked. At the bank, the teller asked if I was making a large purchase. I told her it was for a medical procedure that required cash payment. She processed my withdrawal without more questions. I drove straight to Dr. Smith's office, feeling excited and nervous. The surgery took about 2 hours. I woke up feeling groggy but excited to see my new body. Dr. Smith said everything went well and I should see beautiful results once swelling went down. My chest was wrapped in bandages and felt tight and sore, but that was normal. When Brad came home that evening, he found me in bed, looking pale and sick. I told him I'd caught a terrible flu at work and needed bed rest for at least a week. He immediately went into caretaker mode, bringing soup and medicine and asking if I needed a doctor. For the next week, Brad took perfect care of me while I recovered from surgery he didn't know about. He made breakfast before work and brought dinner every evening. He'd sit beside the bed, asking how I felt and if there was anything he could do. It was sweet seeing this nurturing side. During recovery, I wore special compression garments that held everything in place while healing. Bandages covered incision sites, and I wore loose pajamas so Brad couldn't see the real reason I was in bed. Every day I felt better and couldn't wait to show him what I'd done. Recovery was harder than expected, though. My chest felt incredibly tight and sore, and I couldn't lift my arms above my head for several days. One side seemed noticeably bigger than the other, but Dr. Smith had warned that uneven swelling was normal during healing. About 10 days after surgery, the larger side felt warmer and more tender than it should have. When I touched it gently, it felt harder and more swollen. I called Dr. Smith's office, and the nurse said some asymmetry was normal, but I should come in if concerned. I decided to wait and see if swelling would go down. 2 weeks after surgery, I felt ready for the big reveal. I went shopping for the most appealing lingerie I could find, spending $200 on a gorgeous lace set that would show off my new curves perfectly. I planned Brad's favorite dinner with candles and wine. I spent hours getting ready that night, doing makeup and hair perfectly. When I looked in the mirror wearing my new lingerie, I could see the difference surgery had made. My chest looked fuller and more proportional, even though one side was still larger. I knew Brad would be amazed. When Brad came home, I had dinner waiting and the apartment lit with candles. He seemed surprised by the romantic setup and asked if there was a special occasion. I told him I wanted to show appreciation for all the care he'd given while I was sick. After dinner, I told Brad I had a special surprise and he should wait in the bedroom. I went to change into my new lingerie, feeling incredibly excited about his reaction. This would be the moment he realized how lucky he was to have someone who cared enough to improve herself. When I walked out in my revealing outfit, Brad's jaw dropped. But instead of looking amazed like I'd expected, he looked confused and concerned. He stared at my chest and asked why one side looked bigger than the other. I couldn't believe that was his first reaction. I got defensive and told him it was temporary swelling from being sick, and everything would even out soon. I couldn't understand why he was focusing on minor details instead of appreciating the overall improvement. He said I looked different somehow and not necessarily in a good way. He apologized and said he needed time to process the change. He said I looked beautiful, but something seemed off about proportions. I told him he was being ungrateful considering how hard I'd worked to surprise him. He said he didn't understand what kind of gift I was talking about. I tried explaining that I'd noticed his preferences in women and decided to give him exactly what he wanted. He looked confused and asked what I meant about his preferences. I mentioned the websites I had seen in his browser history, and his face went red with embarrassment. He said that didn't mean anything and that he loved my body exactly the way it was before. I didn't believe him for a second. Men always say they like natural beauty, but their actions tell a different story. If he really thought I was perfect before, why was he spending time looking at women with enhanced figures online? The evening didn't go like I'd planned. Instead of being grateful and excited, Brad seemed uncomfortable and kept asking questions about what I'd done. He said my chest looked swollen and unnatural, and he was worried something was wrong. I told him everything was fine. A week later, my chest was hurting more than it should have been. The larger side was getting increasingly red and warm to touch, and skin around the incision was starting to look angry and inflamed. I tried convincing myself it was normal healing, but deep down I was getting worried. I finally made an appointment with Dr. Smith about my concerns. When he examined my chest, his expression became serious. He told me I'd developed an infection around one implant and it needed immediate medical attention. The infection could spread if not treated properly with antibiotics and possibly corrective surgery. Dr. Smith explained I would need another operation to clean out the infection and possibly replace the implant. This type of complication was uncommon but not unheard of and would cost an additional $5,000 to fix properly. I asked if there were cheaper alternatives, but he said surgery was the only safe option. For the next few days, I kept the infection hidden from Brad by wearing loose shirts and avoiding intimate situations. I took pain medication and tried keeping the area clean and dry. I researched antibiotic creams online and bought some from the pharmacy, hoping that would clear up the problem without expensive surgery. But infection kept getting worse instead of better. The skin was turning deeper shades of red and purple, and I could feel heat radiating from the area even through clothes. I was getting more worried, but I didn't have $5,000 for corrective surgery, and I wasn't asking Brad for help after taking his mom's treatment money. Meanwhile, Brad continued being distant about my appearance. He'd look at my chest with this concerned expression, like he was trying to figure out what was wrong. Several times he asked if I was feeling okay or needed to see a doctor. I kept insisting everything was fine. 3 weeks after surgery, Brad was looking through our joint bank account online for tax paperwork. He found the $8,000 withdrawal from the day of my surgery and came into the living room holding his laptop with a completely shocked expression. That brings us back to this morning when everything exploded. After I told him about the enhancement surgery and he freaked out about his mom's treatment money, he packed his bags and left. He said I had 2 weeks to find somewhere else to live since the lease was in his name. Now I'm sitting alone in this apartment I can't afford, looking at my reflection in the bathroom mirror. My chest definitely looks different than I expected. One side is significantly bigger than the other, and there are angry red marks around both incision sites. The larger side feels hot and tender when I touch it, and the skin is turning purple and inflamed. I tried calling Brad to apologize and explain my reasoning better. Maybe if I could make him understand this was all for him, he'd realize he was overreacting about his mother's situation. But his phone went straight to voicemail, which means he probably blocked my number. I left a message saying I understood he was upset, but we could work through this together if he'd just listen. I said his mom would probably be fine with regular hospital treatment, and we could save for the private clinic later if really necessary. I told him I loved him and wanted to fix our relationship. The next day, I got angry text messages from Brad's sister calling me horrible names. She said Brad told the family what I'd done, and they all hated me now. She said their mother cried when she found out her treatment was delayed because of my vanity surgery. I texted back that it wasn't vanity, it was relationship investment and self improvement. She responded with more angry messages about how selfish and evil I was. She said their mom had been looking forward to starting treatment, and that delay could literally kill her. I tried explaining that older people are naturally more resilient than they appear, and a few more months of waiting probably wouldn't make much difference in the long run. Brad's sister said I was delusional if I thought stealing from a cancer patient was acceptable under any circumstances. I went to work at the salon, but my chest was hurting so much I could barely focus. My boss, Linda, noticed I looked pale and kept wincing when I moved my arms. She asked if I was okay and if I needed to go home early. I told her I was fine, just tired from relationship stress. That evening, I started looking at apartments online within my budget. Everything decent costs at least twice what I make monthly at the salon. Most places I could afford were in bad neighborhoods or tiny studios without proper kitchens. I'd never looked at housing costs before because Brad handled financial planning. I called my sister Emma to ask if I could stay with her temporarily, but she'd already heard what happened from Brad's sister since they're friends on social media. Emma said she couldn't believe I'd done something so selfish and cruel and that I was on my own. I tried calling my mom, but she'd heard the story too and was completely disappointed. She said she'd raised me to be better than this and was ashamed of my behavior. She said Brad was a good man who deserved better treatment, and his poor mother didn't deserve to suffer because of my vanity. My mom said I needed to find a way to pay Brad back and apologize to his whole family. She said stealing from a cancer patient was unforgivable, and I'd better figure out how to make this right. I tried explaining it was our joint money and I'd invested it in our relationship, but she wouldn't listen. I don't understand why everyone's being so dramatic. People get plastic surgery all the time to improve their relationships and confidence. I didn't hurt anyone by making myself more attractive. Brad's mom is elderly and was probably going to pass away eventually anyway. At least now I had a chance at happiness and beauty while still young enough to enjoy it. The infection in my chest was definitely getting worse despite attempts to treat it at home. The skin was turning darker shades of purple and yellow, and there was definitely some kind of discharge coming from the incision site. I knew I needed professional medical attention but didn't have $5,000. I tried calling Dr. Smith's office to ask about payment plans. The receptionist said they required full payment upfront for all surgeries and didn't offer financing for cosmetic procedures. She said I could apply for a medical credit card, but my part-time income probably wouldn't qualify. I researched my symptoms online, and most websites said untreated surgical infections could become very serious. Some articles mentioned scary complications that could result from ignoring infected implants. I was starting to get genuinely scared, but didn't have anyone to call for help. Brad had blocked my number completely, and my family wasn't speaking to me. I didn't have close enough friendships to ask for $5,000, and I'd already maxed out credit cards paying for the original surgery deposit and recovery expenses. I felt completely alone and trapped. I tried hiding the worsening infection by wearing loose clothing, but the pain was becoming unbearable. I could barely lift my left arm, and I was starting to run a low fever that made me feel weak and dizzy. I knew I needed medical help, but was terrified of the cost. One morning, I woke up feeling so sick I could barely get out of bed. My fever was much higher, and the infected area felt like it was on fire. I looked in the mirror and saw that purple discoloration had spread significantly, and there was definitely pus leaking through my shirt. I called an emergency medical helpline about my symptoms. The nurse said I needed immediate medical attention and should go to the emergency room right away. She said surgical infections could become life-threatening very quickly if not treated properly. I asked about cost, and she said my life was more important than money. The emergency room doctor said I had a severe infection that needed immediate surgical intervention. He said waiting any longer could result in blood poisoning, which could literally kill me within hours or days. The corrective surgery would cost around $5,000, exactly what Dr. Smith had quoted. I tried negotiating with the hospital financial counselor about payment plans or charity care. She said cosmetic surgery complications typically didn't qualify for reduced cost care since the original procedure was elective. She said I could apply for a medical credit card or ask family for help, but surgery needed to happen within the next day or two. I was desperate enough to try calling Brad one more time from the hospital phone. When he answered and heard my voice, he started to hang up immediately. I quickly told him I was in the emergency room with a serious infection and needed help. He was quiet for a long time. Finally, Brad asked what was wrong and if I was really in danger. I explained about the surgical infection and how doctors said I could die without immediate corrective surgery. I told him I was scared and alone and didn't have anyone else to call. He asked how much the surgery would cost. Brad was silent for another long moment. Then he said he would consider paying for the corrective surgery, but only if I agreed to meet with his mother in person and apologize for what I'd done. He said I'd have to explain exactly how I'd used her treatment money and tell her I was sorry for delaying her cancer care. I said that seemed cruel and unnecessary given my current medical situation. He said those were his only terms and I could take it or leave it. He said his mom deserved to hear an apology directly from me, and it was the least I could do after stealing her medical money. I spent another sleepless night in the hospital thinking about Brad's offer. The idea of apologizing to his mother felt completely unfair since I'd been trying to improve my relationship with her son. But I was getting sicker by the hour and didn't have any other options for paying for needed surgery. The next morning, a different doctor said my blood work showed signs of blood poisoning starting to develop. He said I needed surgery within the next few hours or I could go into shock, which had a high mortality rate. I was scared enough to call Brad back and accept his terms. Brad agreed to pay for my corrective surgery, but said I had to meet with his mother immediately after I recovered. He said she was currently staying at his apartment while receiving her delayed cancer treatment, and I'd have to face her and the entire family to apologize. The corrective surgery took several hours, and I woke up feeling weak, but relieved the infection was finally being treated. The surgeon said he'd had to remove one of my implants completely because infection had damaged too much tissue around it. He said I'd need another surgery in a few months to replace it, costing several thousand more dollars. I looked down at my chest and saw I now had one normal-sized side and one completely flat side, with surgical drains and bandages. I looked worse than before I'd ever had surgery, which seemed impossible after spending so much money and going through so much pain. A week later, I had to fulfill my agreement and apologize to Brad's mother. I took a taxi to his parents' house, feeling humiliated and still weak from surgery. When Carol answered the door, she looked much thinner and sicker than I remembered. The chemotherapy had obviously taken a toll, and I could see why Brad was so worried. I sat in their living room surrounded by Brad's entire family while I explained what I'd done and apologized for using Carol's treatment money. She listened quietly, then said she forgave me but hoped I'd learned something important about priorities and values. She said she was disappointed that someone so young could be so selfish about other people's suffering. Today I'm sitting here looking at myself in the mirror, seeing the mess I've become. My chest looks worse than before I ever had surgery, with scars and asymmetry that make me look like a medical experiment gone wrong. I have no boyfriend, no family support, no place to live, and no money to fix any of these problems. Sometimes I wonder what would have happened if I'd just been honest with Brad about feeling insecure instead of stealing his mother's money. Maybe we could have worked through my body image issues together, or maybe he could have reassured me that he loved me the way I was.
Subscribe to never miss a new story.